A clinical associate is a mid-level healthcare worker in South Africa
who are a gap between nurses and doctors,
aimed to bridge the gap between various healthcare professionals and contribute to the healthcare team as a whole.
We mainly deal with the clinical aspect of everything in a clinical environment. So it's mainly procedures, skills, things like that.
We are trained to see a patient from the time they enter the door to the time of discharge.
They provide a lot of first contact primary healthcare for patients, and they are more patient-centered than, for example, doctors who are more centered on diseases, or nurses who are more centered on physical care of the patients.
And I am able to consult with patients, manage patients, and once I am uncomfortable, I have my supervising doctor to consult with to help me to manage that patient as holistically and accurately as possible.
They work under the supervision of a medical practitioner, and that supervision starts off as direct supervision and it loosens to indirect supervision.
Went through rigorous clinical training, who is multifaceted in the way that they are, they're generalists in terms of the skills and procedures that they're capable of doing.
And over the years it's varied. Initially it was around primary healthcare, but now it's gone to be in the private sector, it's gone into be tertiary institutions.
So where there's generalist medicine or the practice of general medicine is required, that's where a clinical associate would be fit to work in.
A clinical associate is a member of the team.
For me, a clinical associate is a superhero.
If we recall, this program started by, it's basically the initiative of the former Minister of Health, Shabalala. May her soul continue to rest in peace. They did a tour of the African countries and they saw that what people were doing, and the idea was to get this mid-level healthcare workers who would basically be between the nurses and the doctors and kind of, free the doctors a little bit so they can concentrate on what they know best.
So as a clinical associate student, all of us in my class, there was 25 of us, nobody really had an idea initially about the clinical associate program. But as the years developed or went on, I would say that in our third year, we started understanding what it meant to be a clinical associate. So I think that was really special with that first group of 25 students.
We've watched this degree grow from that time, and it's grown to such an extent that a lot of things have changed, including the way we teach things. And I'm actually glad to be part of teaching this degree, which I had first started in this very university.
Reflecting in the past 10 years, I think there's been so much development. If we look at that first group of clinical associates where there was just 25 students, we now have 55 students in third year, there's 81 students in second year, and there's 91 students in first year. So together that's 200 and something students all together.
Hi, my name is Kamano Mutsuha. I am a 20-year-old born and raised in Soweto, and I'm a first-year clinical associate student from the University of the Witwatersrand. I met a clinical associate myself, I think 4 years ago. I think I was 16. And when she spoke about the program, I immediately decided that this is what I wanted to do.
To be honest, I did not know about it. I knew about it while I was in the course.
I actually knew quite a few clinical associates from back home, so that sort of inspired me to get into the program.
I chose to study BCMP because I interviewed a clinical associate in my town, and he is the one who told me about the course.
When I did my research, I found out about this program. I Googled it a little bit. There wasn't much about it, but from the little that I found, I fell in love with it.
Why I chose BCMP is because it was only 3 years and I wanted something very short and sweet.
One thing I'm really proud of is that this degree was actually my first choice. Like most people were like, oh, I want to be a doctor. I was like, no, I want to be a clinical associate. So yeah.
You have students who are post-matric, coming in the first year knowing basically nothing, when it comes to clinical medicine. And within such a short time of, 3 years, and then you see them exuding so much confidence. And, that's really, for me, it's something that I love to see. I really enjoy seeing them in the first year and, with their naivety and with their, lack of knowledge, of clinical medical knowledge. And then within 3 years, you look at them and they are talking like experts in the field.
They start seeing patients from their first year, and also they have the opportunity to see patients in relation to the theory that they learn, and I think that's very helpful for them.
We normally teach the students procedures as well as how to clock and see patients on a daily basis. We generally have TUTs every week where we discuss relevant clinical topics and refresh their knowledge regarding different medical conditions.
Since I took over the department here in 2019, we have had clinical associates rotating with us on a 2 to 4 weekly basis. They basically spend time in the emergency department working with the doctors and our nurses in treating patients, in following up patients that have already been admitted as well. And then they also have a role in assisting us with triaging patients and assisting patients that can move on to fast tracks where they can be quickly assessed and receive treatment and move out to the emergency department.
So, with the kind of students that we get, they are very dedicated and they learn a lot. So yes, at first it's a bit difficult, but as the weeks go on, we are able to get a lot from them.
In terms of the requirements of training here at the departments, they are assessed in terms of their patient care, their interview strategies and their overall clinical management. Over the 4 weeks they have ongoing evaluations in terms of patient presentations, and then also bedside teaching and quizzes where they are assessed on common emergency conditions.
That would include taking a medical history with them, a proper examination with them, also in the process giving the clinical associates some skills and having them, with the permission obviously of the patient, to assess and examine the patient as well to improve their skills in all that they do. And in between cases, if there is such a case maybe for theatre, then the student who has assessed the patient for theatre has the opportunity to also assist or observe the case in theatre as well.
Oh, it's been really, really good. I am enjoying the fact that I've been exposed to the hospital environment and the clinical environment very early on from the first year.
Literally just get thrown straight into the deep end, which is very daunting, but also really, really cool.
Quite amazing that in first year they let us go to hospitals and deal with patients.
Yeah, it's been really fun working with patients, doing procedures and stuff like that. Obviously,
at the end of the day, it's rewarding when you go to the hospital and you do your rotations and you find patients and you get to help patients.
To work with patients who are pretty much relying on you to provide the best care for them while you're still young. I think that's the most challenging thing that I've faced so far.
But so far it's really been great, like it's more hands-on, like you literally get to do everything practically more than theoretically. So by the time you get to final year, you're actually comfortable with seeing a patient, writing your own notes and doing all that.
The utility of the clinical associates within the emergency department, firstly, is in terms of triage and managing patients that can move into fast-track pathways. They have the expertise to be able to manage the common conditions and allow patients to move faster through the ED and to cut down on our waiting times.
They were helpful to doctors because they make their work easier. The doctor will jot it down, the clinical associate will be
close to the patient, put up drips, taking blood gases, taking the assessment.
They also have great utility in assisting the doctors in performing common procedures such as doing ECGs, placing chest drains, doing central lines, all the way up to doing intubations for difficult airways.
I didn't know much about clinical associates before I started here, but as soon as I got here, I saw what they can do and what a value they add to the healthcare system. And I think that was especially evident in the COVID-19 pandemic.
Clinical associates are vital in terms of they play a critical role in terms of within the health system in itself, especially within the district health service, because some of their level of information is above in terms of that of a primary healthcare nurse. So in terms of where they are within the district settings, they're able to also assist with limiting of referrals to the next level of care.
I think the clinical associates definitely benefit the South African healthcare system greatly, as unfortunately in healthcare we have a very, very large demand and are quite overwhelmed regarding the patient to doctor number as well as patient to nursing number.
And I have seen that this clinical associate program has actually produced clinical associates who have gone beyond that mid-level clinical worker level to now do things that are even specialized. You know, we've got clinical associates who are doing anesthesia, we've got clinical associates who have PhDs now, we've got clinical associates who are doing their masters in different fields of medicine. I mean, this is really encouraging. So I would really say that they have a big role to play, and it's actually much more than we had thought.
Over the 10 years of being the first graduate of this degree, I had done a lot of things, achieved a lot of experience there. And I think the highlights of the years there that I spent was managing a division by myself. So I managed the obstetrics and gynae department. I had done cesarean sections, multiple of them. I even lost count. I've taught cesarean sections to other doctors, and I've done general surgery as well.
During my time in the last 10 years working, I've also volunteered as a mentor with the Mtombo Youth Foundation in the KwaZulu-Natal province. And I've also been involved in health advocacy projects with the Rural Health Advocacy Project. Being a clinical associate in this space truly allowed me to network and show people the impact and the value add of the profession.
I had gone into research for about a year and a half. That was also a highlight for me, something different. She was part of 3 or more research studies.
We are a young, upcoming profession that is able to go into communities at various levels as clinicians, researchers, academics, advocacy agents, and truly make an impact to change the healthcare system.
Anytime you are a pioneer or you're in a pioneer program, you have this almost sense of having to introduce yourself every time, which has been a very big challenge for me personally, because everywhere I go, people ask me, so what is a clinical associate? What do you do? What can you do? What can you not do? So there's a lot of having to prove yourself constantly to different people.
Being a clinical associate in the academic space, in communities and in meetings and departments where no one is familiar with the profession, does pose certain obstacles. However, the opportunities that arise from this challenge has been quite significant. People that are not familiar with the profession, are not familiar with our value add, now give me the opportunity to teach them and to show them what we can do and what we are capable of.
But I do think that they're being underpaid. For me, well, yeah, I don't know how that was agreed upon in terms of that they should be paid, because it becomes a problem when you want to attract, I should think, keeping them in public.
Our professional identity is not something that, you know, even now if you ask somebody, do you want a clinical associate? I think, I mean, they wear scrubs, so, you know, there ought to be someone who's in the medical field helping out. So it's been a challenge in that regard.
Let me say, the most positive thing about being a clinical associate is that I have never been unemployed. I was working while I was in my honors, I was working.
The clinical associate profession has been a non-limiting profession, and that has been the biggest value add for me as a clinical associate.
I did not struggle to get into a postgraduate program. I got a postgraduate. I got accepted into a postgraduate diploma in public health at UNISA and at Monash. I got accepted into a postgraduate diploma at University of Pretoria.
Seeing that students who pass through this program are actually taking responsibility of becoming teachers, you know, coming back to teach the students who are enrolled into the program. So that for me is something that I really love to see, you know.
The highlight of my course is being in the hospital. Like, we go to the hospital 4 days a week.
And it evoked like passion for people more than I've had before. So
we do something called a CBL, which is case-based learning, which sounds weird, but you learn about a specific disease by having like a patient case.
I enjoy the clin skills. I really do enjoy learning how to practice new skills on patients and how these different types of skills can help you find what's wrong and what's not wrong. And yeah.
Give me wards any day and any time. Being in the space or in the field where you see people.
My clinical rotations, that has been so far like my best highlight.
I really appreciate the respect that patients do have out there for healthcare workers, and
being in the hospital, being active, seeing patients, and learning as we go along, that is more of the highlight in my eyes.
Definitely the clinical rotations. My group is amazing, so I really have fun with them.
I think learning about health conditions, you know.
You do get to see yourself grow in certain areas. I still, for example, get excited if I get an IV line onto a patient.
It was really nice to hear from patients, even with doctors, when they just tell us that we appreciate your help. I couldn't have done this without you. That's really nice to hear from them as well.
Be bold in your learning, you know, take advantage of the time that you have now, because once you have a practice number, and I always say this to the students, I'm like, guys, make the mistakes now, you know, you still have that student practice number to say, oh, shame man, it was a student, you know, and you making an error, it's not the end of the road. You make an error, it's about you coming back, you know, how do you come back from that error?
I think no matter what you do, hard work will always serve you well. No matter where you are, hard work will always serve you well. And people may not remember your name, they may not remember your face, but they will remember that hardworking clinical associate, or that clinical associate who made a difference to that specific day or that specific shift.
Firstly, develop a culture of reading. Because if you develop a culture of reading, there's a curiosity to information that is, that you're given or that you come across. And it's not that you take everything for face value, but then you're curious to want to know more, to read more.
We are in a practical space, this whole 3 years from first year is practical. So go ahead, get used to, this is the clinician that you're going to become. So you start figuring that out now as a student.
Be willing to learn, whether it's from a nurse or an RNA or whichever practice you are in.
Develop your critical thinking abilities. Because those are the things that help you in terms of problem solving. And I think every single clinician, that's what they need, especially in South Africa, where we experience so many challenges and problems with the healthcare system, and we need people that are not just identifying the problems but are bringing solutions to the table.
If you see the value, if you have passion for healthcare, if you have passion for patient advocacy, if you have passion for working in a team and bringing about change, then the clinical associate profession is something that can bring you all the opportunities you want.
So with the academic aspect, I think a lot can happen in relation to the curriculum. And when you tie that to the 21st century medical ways of doing things, that means including more technology, technology in simulation, technology in using the tablets.
And advanced career options for a lot of the clinical associates. So I see a very bright future for them. And hopefully we can actually get them to be on top of all recommendations to whenever either a doctor or a surgeon is looking for, someone to be part of his team. I'm hoping that the clinical associates could actually be part of that.
Apart from the fact that we need more healthcare workers in general, I think that we also need more clinical associates to fill the gap that we have of like a mid-level healthcare worker that can provide a large range of different services. We've seen it be successful in a lot of the rest of the world, in first world and third world countries. So it's not really a question of do they have a place, it's when will they have a place.
My vision or my hope is that in the next 10 years, you will see a clinical associate in every single space, be it healthcare, be it research, be it medical technology, be it engineering for medical equipment. I believe a clinical associate can be as versatile to contribute to every single space in the South African system.
I think with the number of clinical associates, a number of students who are going to the clinical associate degree, I do see it growing. I still do have a hope that we will be more recognized in government and in the state hospitals, because I do think the shortage of doctors that is constantly being spoken about year in, year out, the answer is there, but it's not being utilized.
Quantity, number one, we need more clinical associates. We need, we've got a great team of young clinical associates running our division this side. A curriculum that's more relevant to the time that we're in now, right? And then also, of course, everybody wants me to say this, a better pay structure and more government posts and basically, just opportunities for everyone to grow and more access to postgraduate programs.
For me, I would like to see, number one, a clear career pathing, because for me, I think there's no clarity in terms of like, do they become senior clinical associate chief or like what? Like after 5 years, I know that I think there was also a debate somewhere where they were like, okay, when exactly do you stop signing? Like for how many years? And then what happens after 5 years? Do they become senior clinical associates?
The challenges and problems that we as clinical associates inherit on graduation around professional development, regulation, are done away with, or they sorted out by then. And that our sole purpose or our priorities as a profession is around service delivery, research, patient advocacy, and clinical governance.
Bringing in more of the humanities into the curriculum. I think if you're going to be a healthcare professional, yes, you learn the knowledge, the skills, the attitudes, but there is that element of you're going to work with people, and you need to have that self-awareness and that environmental awareness and awareness of others.
We've already embarked on a program to employ clinical associates in our ED, starting on a part-time basis. I'm hoping that will improve our patient care overall, and as I've already mentioned, it will allow the other staff a little bit more time to spend with the patients as well. The other thing that we're pushing for is to have clinical associate full-time posts put into the emergency departments.
I'd like to see clinical associates becoming a very big part of the multidisciplinary team in healthcare. I think they provide a great service.
I'd like them to also assist in us, like in maternity, casualty, because those departments are very busy, and especially also in the wards as well. So it will be nice to see it growing beyond being in the clinics and outpatients department.
I see an increased number of clinical associates in South Africa. I see clinical associates getting into various workspaces, both public and private, NGOs, the research spaces, because they're an individual that has such a diverse skill set. Any workspace that needs that skill set is where a clinical associate should be.